Hello, class. Mr. Campbell, good to see you. Even though I can't really see you, I know you're there watching this. And also, we might be watching this in class. If we're watching this in class, there's a good chance today is Friday. So if it is Friday, happy Friday to you. Now that we have that out of the way, I wanted to talk to you briefly about the heart. In case you don't know what a heart is, I just brought one along for you. That's what a human heart looks like. This is not a real heart, it's plastic. But if it was a real heart, chances are the person would not be alive because it's not inside their body. Write that down. Okay. Anyway, in case you maybe didn't know this by now, the heart runs on electricity, just like your car runs on electricity. Also gas. See, there's a lot of parallels there because humans have gas too. Pause for a laugh. Oh, that's in my notes. Excuse me. Sorry about that. Anyway, when something goes wrong in the human body, that's when we show up to their house, normally after somebody calls 911. Now, when we hook them up to the cardiac monitor, otherwise known as the EKG, we will see one of many typical EKGs. You guys are going to memorize 7 EKGs by next Friday. I know we were supposed to do it by this Friday, but let's be honest, sometimes we have to miss deadlines, am I right? Oh, and to the people that are talking right now, shh! You didn't think I knew you were talking? I hear you guys right now talking while I'm playing this video. Okay, let's get back to what we were talking about. Have you guys ever heard the saying, saving the best for last? Well, that's not what we're doing here. We're saving the worst for first. That's right, I just made that up. This one that you see right here called asystole is the worst. If you're going to pick a certain kind of dead, this is not the dead you want to be. This is the worst kind of dead because guess what? All the electricity has left your heart. I don't know where it went, but it's gone. You don't have any electricity left in your heart. It's flat line. That's why you don't see any movement of the line because the electricity is gone. All right? Bad, very bad. This is the worst kind of dead you can imagine. But the good news is we can still do CPR. So basically what that means is, as you can see from this picture right here, we need to push down on the chest. How many times? As many times as it takes, which in this case will probably be a lot because all of the electricity is gone. I'm going to be honest with you. People who are in asystole have a very low survival rate. That's why I put right here, patient is dead. No pulse, no breathing. Treatment, CPR, that's it. Not AED. AED will not work in this circumstance because there's no electricity to reset. It's all gone. All right, now that you're all depressed, let's move to the next one. Oh, and don't forget, if you find someone who's in asystole, if nobody's called 911, please get something that looks like this, which is called a cell phone, and call 911. Which kind of doesn't make sense because if nobody called 911, how would you know they're in asystole? How are they going to look? They're going to look unconscious, unresponsive, lifeless, no breathing, no pulse. But chances are, if you don't have an EKG monitor, you won't know what cardiac rhythm they're in. What is their EKG? You don't know. So just do CPR. All right. Let's talk about the next kind of dead. Let's go to VFib. This is actually the most common EKG during a cardiac arrest. This is the most common. All right, it's called VFib. You can see right here where it says VFib. That's short for ventricular fibrillation. Also, fib means lie. So if you say, I'm not fibbing, that means I'm not lying. And I'm not fibbing about this. VFib is bad. Patient is dead, all right? But not as dead as the other dead that I just told you about. This is like maybe slightly less dead, but still dead. Does that make sense? Okay, so what do we do for this one? Well, again, we call 911. We start CPR, chest compressions, right? And we go get an AED. What's an AED? I'm glad you asked. This is an AED. They all look a little bit different, but basically an AED is what we use to shock somebody when their heart's not beating. So make sure you get an AED, okay? See? It has directions on it for people that don't know what they're doing. So what do? We start CPR, we get an AED, and we shock them, and hopefully that electrical shock will basically zap this thing back into pumping again. Because right now it's not pumping. It's just fibrillating like this, which is not good because that means it's not pumping any blood to your brain or to the rest of your body. And your brain needs blood, oxygenated blood, or else you die. So make sure you get an AED, you call 911, and that's it. Oh, and do CPR. Okay? Again, there are no organized heartbeats here. These are not heartbeats. It's just fibrillating. And I'm not fibbing when I say that. All right, what is the next EKG? You already memorized two, right? Asystole and B-fib. What's the next magical EKG we're going to look at? How about we look at a normal EKG? This is a normal EKG. This is what most of you have right now, if you're healthy. This is what your EKG should look like. It should be approximately 60 to 100 beats per minute. So every time you see one of these things right here, see, that's a QRS. Each QRS represents a heartbeat. All right? This is me pretending that I'm a heartbeat. Bop, 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 bop. I know it sounds like the Jaws theme, huh? All right, so a QRS is a heartbeat. It must be narrow to be normal, not wide. And it must have P waves. See these? These are P waves right here. This is a stable, normal rhythm. That's why I put this happy face with the thumbs up. Because he's happy because he's not dead and his heart is beating normal. So for those of you that are talking right now, ignoring this video, you should be happy that your heart is beating normal. Otherwise, you wouldn't be able to disrespect your teacher right now and talk to that person that you're talking to. You know who you are. Hope you feel guilty. All right. What is a treatment for a normal sinus rhythm? Nothing, because it's normal. You don't need to do anything. So this one's good. All right. So we looked at asystole, V-fib, and normal. I'm sorry, I'm getting choked up. This is just such an emotional topic for me. Let me get some water. Hold on. How are you guys doing? You guys doing all right? It's good water. This was bottled in Diamond Bar. That will be on the quiz. Okay. All right, what else do we need to know? So we have asystole, V-fib, and normal sinus rhythm. Here I go getting choked up again. It's just an emotional topic. I'm going to explain this one last, okay? PEA, it's kind of weird. All right, what if your heart is going too fast or too slow? You're still alive, so you're not dead. You're happy because you're not dead. But something's wrong because your heart is beating either too slow or too fast. All right? Well, here's the slow. It's called sinus Brady. Brady, like the Brady Bunch. You know what I mean? Get the reference? Because, if you've ever watched the Brady Bunch, you probably, said, what's wrong with these people? They seem a little slow. That was not politically correct. I shouldn't have said that. But my point is, you will never forget now. Brady means slow. Think of a turtle. Think how slow turtles walk, right? Well, if your heart is beating less than 60 beats per minute, that's too slow, unless you're a marathon runner. Marathon runners, by nature, have a slower heart rate because they work out all the time and their heart is perfectly conditioned. And there's more science to it, but I don't have time to explain it, mainly because I don't know. Anyway, a sinus Brady is still a normal heart rhythm because it's narrow, it has a P wave, it has a QRS, It has a T wave, but it's just the rate is too slow. So again, sinus brady is the name of the slow heart rate. Now, if it's too slow, we might actually have to give them medication to get that heart rate back up. Because as you know, a normal heart rate should be between 60 and 100 beats per minute. If your heart is only beating 20 times per minute, you're going to be hating life because you're going to feel like you're about to die. Because you probably are. Because that's not enough to sustain life. All right? So, if they have symptoms, we'll treat the symptoms accordingly. But we're not going to defibrillate them. There's actually more to this if you're a paramedic where you can do other things that do involve electricity. We call it Edison medicine. And when that happens, it's shocking. Get it? That was shocking because of the electricity. Never mind. All right. Consult a paramedic if you have someone whose heart rate is very low like this. All right. The next one is, if it's going too fast, is called sinus tachycardia. Like you know, like on the Fast and the Furious, they have this little things in their car that tell them how fast they're going, like almost like a speedometer, except it tells you your RPMs. It's called a tachometer. Tachycardia means fast. Also, see this picture right here from the Fast and the Furious? Just remember, this guy is tacky because he wears ugly shirts. That was stupid. I'm going to edit that out. Tachycardia is fast. So sinus tachycardia. That means more than 100 beats per minute. All right, but it still has a P wave and it still has a QRS, but it's narrow. Later we're going to look at one called VTAC, which is very fast and also wide. It's not narrow. So, what is the treatment for sinus tachycardia? If it's above 100 beats per minute, but it's below 150 beats per minute, we probably won't do much for them. We'll just take them to the hospital. If it's because of dehydration or something like that, maybe we'll give them some fluids through the IV. But other than that, we won't do much for this one. All right, so that's sinus brady, sinus tac. So sinus brady is too slow, sinus tac is too fast. Make sense? All right, so we've done asystole, normal sinus rhythm, sinus brady, sinus tac, B-fib. We have two more. All right, the next one I want to tell you about is called VTAC, ventricular tachycardia. This one is very unique because you may be dead or you may be alive. You can have VTAC with pulses, meaning they're still alive, or you can have VTAC that's pulseless, meaning they're dead. All right, so if they're dead, we start CPR right away and we get an AED. All right, again, this is an AED. This is an AED. If they have this deadly heart rhythm of VTAC, this AED will shock their heart back into a normal heartbeat. Make sense? But if they're alive and they're talking to you, but they are still in VTAC, I don't know how to say this. They're about to die. So you need to make sure they get to the hospital as soon as possible. Now, if you're a paramedic, there are medications you can give to deal with this. You can also shock them while they're alive. I know that sounds cruel, but it's better than death, right? So ultimately, our goal is to get this person to the hospital as quickly as possible. And something is going seriously wrong with their heart. And hopefully they don't die. But if they do, we start CPR and we defibrillate them with an AED. So notice a common denominator here. Anytime someone is unconscious, unresponsive, and they look like they're not alive, then we need to do CPR. We get CPR going, and we get an AED. And if the AED says that there's no shock indicated, then we just continue CPR. All right, so we went over asystole, normal sinus rhythm, sinus bradycardia, sinus tachycardia, ventricular fibrillation, and ventricular tachycardia. The last one that we need to go over is called PEA. PEA. Now, this one is extremely weird. Well, because I have to explain why. This could be any EKG rhythm, like it could look like anything I just showed you. But the difference is, in this one, for sure, there will be no pulse. So in other words, you see their heart rhythm, you see their EKG, but when you check their pulse, there's no pulse. It's not matching anything. It could even look like a normal sinus rhythm like this. It could look like this. But when you check their pulse, there's nothing there. Okay, what that means is essentially there's electrical activity in the heart. There's electrical impulses, but there's no mechanical activity, meaning the heart is not actually pumping. Does that make sense? So all you're seeing are electrical impulses, but you have no mechanical function of the heart. Okay? This person is dead. They need CPR right now. Unfortunately, the AED will not work on someone like this. But you can do effective CPR and consider maybe what's causing them to be in PEA. The most common reason is hypovolemia, or basically meaning that if they've had a traumatic injury, they've bled out inside. So let me ask you this question. If somebody has some type of injury, let's say they got shot or stabbed or something, and all of their blood has bled out, do you think the CPR is going to work? Probably not, right? But we try anyway and we do what we can. Okay? That's not the only cause of PEA. There are other causes. But again, this is a cardiac arrest situation. They need CPR right away. Okay? So, to review, we went over asystole, which is flatline. We went over normal sinus rhythm, which is a normal heartbeat. PEA, which is pulseless electrical activity. It could be any EKG with no pulse. Sinus brady is too slow. Sinus tach is too fast. Ventricular fibrillation is basically chaotic electricity, no actual heartbeats. It's also known as VFib. VTach can be with pulses or without pulses. Either way, it's very serious. And again, just to review, CPR only, no CPR. CPR only, no CPR, no CPR, CPR and AED, CPR and AED, unless they're alive. Does that make sense? Okay, so those are your 7 EKG rhythms. You need to study each one of these and be prepared to identify them. Next Friday, when you have a quiz, I will have a strip of each of these EKG rhythms, and you will have to identify by name which one is which. Flatline, asystole, normal sinus rhythm, pulseless electrical activity, sinus brady, sinus tachycardia, VFib, and VTach. Let me know if you have any questions. Goodbye.